So, hi everyone. I'm very happy today to be here along with my colleague, Dr. Saras, to share on some knowledge on allergic rhinitis and bronchitis or bronchial asthma. So, Dr. Saras, how often do you see patients with allergic rhinitis?
Thank you, Dr. Mangay. I routinely see many patients in my clinic. Every day, without failure, there will be one patient in my clinic comes with allergic rhinitis. It's very common, very high prevalence. Millions of people are affected globally by allergic rhinitis. It's very common, Mangay.
Yes, I agree with you because I get lots of referrals from her as well for bronchitis patients who are, suffering from both.
Yeah.
Well, maybe you can enlighten us. What is allergic rhinitis?
Before I explain about allergic rhinitis, let me explain what is the upper airway and lower airway. Upper airway dealt by ENT, that's me, and the lower airway dealt by Dr. Mangay, respiratory physician. Okay, whenever I have a problem, patient comes with a cough, I will examine everything. Then if it's not my area, I will refer to Dr. Mangay to look into the lower airway. So the upper airway extends from the nose till the upper end of the windpipe. Below that is the lower airway. Okay. Allergic rhinitis is inflammation of the nasal mucosa caused by allergens. There are many types of allergens. Allergic rhinitis is classified into two types. One is seasonal allergic rhinitis, another one perennial allergic rhinitis. Seasonal allergic rhinitis, only certain period of the year the patient exposed to this allergen. Season time, like pollen, grass, some pollens from the trees, all that. Perennial allergic rhinitis, the patient exposed to the allergen throughout the year, like house dust mite, Indo-allergen. It's also called Indo-allergen, house dust mite, fungal spores. It's also called mold, animal dander like dog's fur or cat fur, all these things. Another one, cockroach droppings. These are the common allergens. And these are the indoor allergens. The environmental allergens are like smoke, cigarette smokes, like all these are the environmental allergens.
I also think the construction sites.
Yes.
Yeah.
Yes, construction. That's the environmental allergens. And okay, Mangay, other than that, do you want to know anything else about allergic rhinitis? It's very common because of the
Basically, it's because of the allergens itself.
Allergens, yes.
Yeah. So commonly, actually, I think patients who have allergic rhinitis, they can also have a lung inflammation as well. The lower airways can also be inflamed sometimes. And sometimes that they can develop into bronchitis, or if it's over a longer period of time, that's when we call it as bronchial asthma.
I think, Mangay, in my opinion, I think it starts always from the nose and then it goes down to the lung. When the patient is exposed to the allergens, he'll have the symptoms of nose block, sneezing, itchiness, itchy nose. It's also called nasal pruritus. And then the postnasal drip, which the patient will have edema of the nose, swelling of the nose, which cause the postnasal drip. The postnasal drip will cause the throat irritation and then swelling at the back of the nose. This will drip down to the lung and it cause cough, chronic cough. That's the time that the respiratory physician will come in and manage this type of cases.
Yeah, there are many pathophysiology why bronchitis can develop. One pathway is exactly what you have explained, Dr. Saras. And the other one is the allergen directly causing inflammation in the airway. So that is also possible. I think from my own clinical practice or some patients which we co-share, what the common allergens that we have always seen is usually dust mites, dust,
yeah.
cat dander, cockroaches, dogs, right? So these are the common allergens we have seen. And I think we also have one common patient who's a staff nurse who has both allergic rhinitis and bronchial asthma. If I remember correctly, she has even allergy to food,
Yes,
certain
yeah, food
food,
allergy,
potato, wheat, rice. So when she has reduced all this allergies, actually her condition improved.
Yeah, I feel allergic rhinitis, it's not life-threatening, but it's impact the quality of life, and
Definitely.
it disturbs the sleep. Patient will feel fatigue and reduce productivity in work at school as well.
And
That's
that
why
is if they only have allergic rhinitis. If the lung is involved, even the exercise capacity and the amount of work a person can do will be affected. So that is why I think if anyone who is coughing and who's sneezing and who's having a nose block, or they are having any wheezing or breathlessness, they should see a doctor as soon
Yes.
as possible. What do you think?
Yeah, I agree with you, Dr. Mangay. Allergic rhinitis should be treated. You shouldn't neglect this until it affect the quality of life. Dr. Mangay, can you tell us what are the common symptoms of bronchial asthma or bronchitis?
Yeah. So usually the common symptoms are cough, wheezing, breathlessness, and pleuritic chest pain. That means, when they breathe in, they may have some kind of a pain in the chest. So this cough is very interesting because bronchial asthma or allergic bronchitis, the cough usually in medical terms, they'll call it diurnal variation. That means it worsens at night and early morning. Even today, I had a patient. She's fairly okay during the daytime, but when she's going to sleep at night, she starts coughing and it worsens early in the morning as well.
But Manga, you see, patients with allergic rhinitis also comes with complaints of cough, symptoms of cough, and patients with bronchial asthma and bronchitis also will complain symptoms of cough. So do you think, is it advisable the patient go and buy the medication from the pharmacy without a doctor's prescription or from doctor's consultation?
Oh, that can be really dangerous for a patient, especially if they just go to a pharmacy and buy some cough mixtures or some antihistamines to relieve their symptoms. They can be relieved for a while, but they'll have to face a lot of complications later on.
I agree with you. I had one patient persistently coughing because of the post-nasal drip and cause inflammation of the bronchitis. I think she already finished about 10 or 20 bottles of cough mixture, and she ended up with diabetic because the cough mixture was content of sugar, a lot of sugar, and she ended up with diabetic. So it's not advisable for the patient.
Basically, not only ending up with diabetes, but I've not had one, I think multiple patients where these patients, they go to a pharmacy, they buy cough mixture or other medication to relieve their cough. They're okay for a while. And they have come to us with very bad TB, tuberculosis of the lung. And that can really damage their lung because the treatment is late.
I agree. So the message is, those who are coughing persistently, please go and check yourself first before buying cough mixture. And
that I agree with Dr. Saras. If you're having a persistent cough, especially a cough of more than 2 weeks, please approach a medical practitioner, right? Whether it's an ENT doctor or a respiratory physician, or at least a general practitioner, to sort out why you're coughing. That's the most important thing.
Especially if you're coughing more than 2 weeks, isn't it?
Yes, if you're coughing for more than 2 weeks, you have to see a doctor to sort out why is causing the cough.
So do you do chest x-ray for patient cough more than 2 weeks?
Yes. It's actually it's mandatory in Malaysia. It's the law by Kementerian Kesihatan that anyone who's coughing for more than 2 weeks should get a chest x-ray, especially to rule out TB in this country. And of course, when we are talking about bronchitis and bronchial asthma, one of it is also one of the thing that we also do is imaging to rule out other condition before we conclude this condition.
But if the chest x-ray normal, don't think there's nothing. Can be sinusitis also. Patient can present with symptoms of postnasal drip and cough. So if chest x-ray is normal, please go and see the ENT doctor and get the scope and see the sinuses.
Agreed. So Basically, I think a proper diagnosis is crucial to treat anyone who's
Yes, I
coughing.
agree.
So it's just not about going to a pharmacy and buying cough mixture. I think we have seen more than enough complications because patients delay coming.
Yeah.
They go around everywhere. They hope cough mixtures will solve their problem. Unfortunately, it does not.
Okay. So how do you diagnose bronchial asthma or bronchitis, Dr. Mangay?
Well, bronchial asthma is basically a clinical diagnosis. We basically ask for the history, and then and also physical examination. And based on our history and all that, sometimes imaging is needed.
History means, is it family history? Talking family history of bronchial asthma?
Is the presenting symptoms. Family history, yes. I mean, basically, if a person comes from a family with history of bronchial asthma, then the likelihood of them having it is way higher. And of course, lung function tests will definitely aid in the diagnosis of bronchial asthma too. Yeah. So how do you diagnose allergic rhinitis or sinusitis, Dr. Saras?
Allergic rhinitis basically based on the history and then examination, physical examination. Through endoscope, we are examining the nose. The findings are usually hypertrophy of the turbinates, or some of the patients can present signs of line above the dorsum of the nose, because they continuously keep rubbing the nose upwards. There'll be a line above the dorsum of the nose. That is one of the sign. Another one is the dark circle around the eye. Due to the histamine, which can cause congestion of the vessels of the eyes, vessels below the eyes, which can have the sign of dark circle around the eye. That is one of the how we diagnose allergic rhinitis. Another thing is skin prick test. We also use diagnose by skin prick test. And then CT scan also. We diagnose by doing CT scan. We can see the sinus, the nasal turbinates, the sinus, the mucus, everything.
Maybe you can tell us what will happen if allergic rhinitis is not treated. What are the complications?
If allergic rhinitis is not treated, it can affect can worsen the underlying asthma, and then it affect the quality of life. And then patient can have, because of their nose is blocked, they can have obstructive sleep apnea. They can lead to obstructive sleep apnea. Patient will become very fatigued, and then it can affect their sleep. They cannot sleep properly because their nose is blocked. And then persistent nose block can cause postnasal drip, which can lead to sinusitis. Because the sinuses are drains into the nasal cavity. The sinus, there's an opening. All the sinus cavity there's opening into the nasal cavity, drains there. This opening will swells up and blocks, and due to the allergy. So this can lead to sinusitis. So chronic sinusitis. If allergic rhinitis never get treated, it leads to chronic sinusitis. And then other than that, that's all. It worsen the asthma. It can lead to chronic sinusitis. Another thing, if the postnasal drip also at the back of the nose, where there's eustachian tubes opens at the back of the nose. So if you never treat this allergic rhinitis, there'll be edema around the postnasal space. It also causes blockage of the eustachian tube, and then patient can complain of ear pain and ear infection, acute otitis media. It's inflammation of the ear as well.
Yeah.
If you never treat bronchial asthma, what will happen?
Well, bronchial asthma is actually, if it's not treated, is a life-threatening condition. Someone can go into a respiratory distress, which means they can be acutely breathless. They won't have enough air to breathe. And that will even, sometimes, patients need to even to be ventilated in ICU. So it can really be a life-threatening condition. And of course, it badly affects their activity of daily living. Some of them, when asthma is not treated, they can't even do simple chores.
I think lower airway is more dangerous.
Like teenagers who are schooling, they can't perform in their PJ activities. They can't do simple jog. So that is devastating, actually. So, but of course, the early symptoms will be the cough. So if you're having cough, that is why I say quickly see a doctor to get it treated, to get it sorted out, to avoid all these complications.
Not shortness of breath, is it?
It's actually before the shortness of breath, it will be the cough.
So how, if never treated, what are the complications?
So as we have discussed earlier, so if bronchitis or bronchial asthma is not treated, apart from affecting their daily lives, as time progresses, at some point, the patient can go into respiratory failure. They can be severely breathless, that they need assistance to even breathe.
So, Dr. Mangai, how do we manage bronchial asthma or acute bronchitis? Can you explain about that?
Sure. So basically, the number one rule is to avoid the trigger. So if we know the trigger, the first thing is to avoid the trigger or to get rid of it. If someone is allergic to dust, as much as possible, they shouldn't be exposing themselves to dust. And apart from avoiding triggers, then comes the healthy lifestyle, whereby to stop smoking and all those things. And lastly, when we come to the medical therapy, there are very many or variable inhalers available in the market now. Based on the clinical severity, the treatment will be tailor-made. How about allergic rhinitis? How will it be treated?
Okay. Allergic rhinitis, what you said just now, avoidance is the best treatment. So those who are allergic to dust, they should avoid dust. How to avoid dust? You shouldn't, whenever you exposed to dusty environment, you must wear mask or anti-dust mite blankets you can use. Avoid if you're allergic to dogs or cat fur, better get rid of the animals. Don't keep the dogs or cats at home. Better get rid of that. And then if you're allergic to cockroach droppings, you better pest control the house. These are the avoidance. Avoidance is the best treatment. And then the second is the antihistamine, like medical therapy, what you said, medical therapy, antihistamine, like loratadine or cetirizine, because histamine is the one causing all the symptoms, sneezing, running nose, nasal pruritus, postnasal drip, nasal congestion, all this caused by histamine and other chemical mediator, which is induced by the antibodies, immunoglobulin antibodies. So antihistamine, or the inflammation, to reduce the inflammation, you can use nasal sprays like fluticasone or mometazone. All this can use. So next treatment is immunotherapy. Immunotherapy, there are two types. One is sublingual and subcutaneous. This is about 3 to 4 years we treat the patient. We desensitize the patient with the allergens, like let's say the patient is allergic to dust. We put dust mite drops below the tongue, and then for certain years, for 3 to 5 years, and then we desensitize the patient. This is the sublingual immunotherapy. Another one is subcutaneous immunotherapy. I think we are giving here in our hospital. Can you share your experience about immunotherapy and how you treat
in bronchial asthma? Well, basically, I think we have commonly shared a few patients on anti-IgE monoclonal antibodies or omalizumab. It's basically a jab. In bronchial asthma or bronchitis, we use it when it is moderate to severe. So when, medically we have treated patients with enough inhalers and oral medication. However, they are not responding, still symptomatic. There's still hope, because lately we have new drugs like omalizumab. It's a jab which is given 2 weeks once or monthly, depending on the clinical severity. And we have seen a lot of improvement. Patients actually do very well with it.
Even in ENT, we used to give this immunotherapy. I see a lot of improvement in patients.
Yes, it makes a difference.
But the disadvantage is the cost. It's too expensive, and the insurance company doesn't cover this,
Yeah, of course, the cost is always an issue. However, there is always a option and there is a way we can treat the patients. And lastly, I think you should also mention about the surgical options for allergic rhinitis. Does it exist?
Yes, we do surgeries for allergic rhinitis patient. Like a patient will present with persistent allergy, recurrent persistent allergy. What will happen? The nasal turbinates become enlarged. Because of recurrent, the nasal turbinates become hypertrophic, cannot reversible. So patient will have symptoms of snoring. So what we do turbinoplasty or turbinectomy. We trim the turbinate so the patient can breathe better. If the patient present with underlying allergic rhinitis with underlying sinusitis, we do functional endoscopic sinus surgery. If the nose is crooked, we do septoplasty. Or any anatomical abnormality like concha bullosa, which block the sinus drainage, we do reduction of concha bullosa. All this part of the sinusitis treatment as well.
Yeah. So in conclusion, allergic rhinitis or bronchial asthma with bronchial asthma, they are both treatable condition. So if you're suffering because of this condition, or you're coughing, you don't know the reason, or you're exposed to something and you're coughing, immediately see a doctor because we can help you. We can help you to diagnose and to be treated, and you can live a life without symptoms of cough, nasal irritation, or even difficulty in breathing, right? So in conclusion, both the diseases, allergic rhinitis and bronchial asthma, are treatable.
I do agree with Dr. Mangai. It's treatable.
It's treatable. So you just need to approach a medical practitioner so that we can help you.
Thank you.
Thank you.